Buzzoff has been a really interesting adventure. It started in around 2007. We were holding a primary healthcare school in Waterloo, which is a little town close to the Thai-Burmese border, not far from Malaria refugee camp. Robin Wales and myself were having a discussion one night about malaria. He was quoting to me statistics that there were 500 million episodes of malaria expected in that year and up to 2 million deaths. And I'd just been reading a report on the internally displaced people done by backpacker medics who said that 42.5% of deaths amongst IDPs were malaria related. We were discussing the problems and the tragedy of this disease when suddenly I found myself saying the words, "What we need to do, Robin, is start an international campaign against malaria and call it Buzzoff." When those words came out of my mouth, we both stopped. It was like something of significance had been said, and we weren't really quite sure how to move on from there, but it was a very good idea. When I arrived back in Australia, I went to church the next day, and one of my friends asked me about what we were doing, and I told him about Buzzoff and the idea about a campaign against malaria. This man is a professor of IT at a major university in Melbourne, and he volunteered his students to make a website for us. My staff and I got together and began to map out in a staff meeting what a campaign against malaria would look like and what it was that we were trying to achieve. We came down with 5 major points. 1, it needed to be simple. 2, it needed to ensure that there was going to be correct diagnosis of the disease and access to the right kinds of anti-malarials. We wanted to create awareness, but we also wanted to train people to be able to manage mosquitoes and manage the disease and recognise the disease in the communities in which they lived. And so the Buzzoff campaign began on those premises. And a few weeks after I had arrived home from Thailand, a man walked into my office and said, "I've just heard about Buzzoff and can I get you some money?" Well, it took nearly 2 years, but the money that he got for us was funding out of a charity in Singapore, and we found ourselves with $120,000 in the first year through which we could do malaria work in Burma. So from 2007 to about 2009, we worked on the Thai-Burmese border. We increased the components in our primary healthcare training so they covered malaria better. We did research, we got our website up, and we began to raise funds to help the internally displaced people and the clinics that were serving them with regards to malaria. We were able to provide thousands of LLIN nets into IDP communities living close to the border. We were able to provide medicines for them. We were able to provide nets for the refugee camps, and we were beginning to roll this out according to the principles we had outlined, and we suddenly felt that we were kind of sitting on the back door of Burma, but we also needed to walk through the front door and see what it was we could do in other regions. In early 2009, I made my first trip to Yangon, and we made contact with people who'd been recommended to us by the refugees that we knew in Malaria camp. We sat down and we heard their stories about how malaria was decimating small communities, and we became convinced that we should be running malaria seminars in Yangon and to try and create an awareness of the malaria problems. So for 2 years we ran seminars in Yangon in various places and probably trained about 150 people. One of the first contacts we made was a man called Saw Marcus Wynne. Saw Marcus is a well-known entomologist, and he also works for the Myanmar Council of Churches Malaria Project. Saw Marcus helped us with our Yangon seminars. But after the 3rd seminar, he said to us, "David, why don't you move these seminars out into the regional areas? Because that's where the problem is, and it's too difficult for the people to come to Yangon." So that's what we did. We thought this was a great idea, and we began to start doing these seminars in regional areas. The first two were in Mandalay and then in Lashio. And instead of having 30 people, we're having 50 people at a time. We were making contact with people in villages where the problems were, and healthcare networks began to form around the seminars that we began to hold. We moved out to Sitwe, and again, it was a very malarious area, and we had an incredibly good time. As we were doing this training, the seminars began to grow. We were finding new content that we could put in. We were tweaking them, we were changing them, we were trying to make them more relevant each time. And so as the seminars continued on in the regional areas, we found that they were getting better and better and better and better. The feedback that we were having was very encouraging. Some people who'd attended malaria training before said that they were the best seminars that they had ever seen. We felt that instead of just tackling malaria, we actually had to tackle the other things that were related to malaria. For instance, we had to tackle nutrition, because if people are iron deficient, the malaria is going to be worse and it's going to be more difficult for them to recover. We also started looking at the practical things, running workshops on how to treat nets, how to take temperature, how to do posters if you were going to do a poster for your local area. It's one of the things that became very important to us was to help people to diagnose the disease quickly. So we began to train them in using rapid diagnostic tests, RDTs. These tests are 90% accurate, and they can give you an answer within 15 to 20 minutes. They're very easy to use. We began to train people in using these as a diagnostic tool. Part of the reason these are so good is because the most accurate way to diagnose malaria is through a microscopist. But microscopy is a very rare thing and mainly only available in hospitals. So RDTs are a fantastic way for people to diagnose malaria and make sure that people get the right medication for the right kind of malaria. In the campaign, we've had several very short slogans that we've been using. One of them is, mosquito nets save lives. Now, a mosquito net provides a barrier between a person and the mosquito, and that's great because they don't get bitten. But a treated net kills the mosquito when it lands on the net. There is a brand or a type of treated net called an LLIN, long-lasting insecticidal net. These nets don't have to be treated for 4 years and are ideal to give to people who are in remote areas who don't have access to net treatments. So we've been pushing the whole idea of the distribution of LLIN nets into remote communities. One of the healthcare networks that formed out of the Mandalay seminar had some doctors in it who were going once a month into areas amongst the Lisu people. They would travel and they would do healthcare and they would do malaria testing. They would make sure that the clinics had the right medicine, and they were distributing LLIN nets that we were giving them. We heard back from this healthcare network after its first year of operation, and the doctors told us that malaria deaths in the areas that they were going back to had reduced by up to 65%. On the Thai-Burmese border, the clinics that were serving the IDP areas that we were encouraging and providing testing, training, LLIN nets and medicine told us that the malarial deaths had gone down by 50%. These were huge numbers and we were really encouraged by them. Overall, more than 500 volunteers have been trained in regional areas of Myanmar. We're seeing reductions in the death rates, and we're greatly encouraged to see how seriously people take the training. We have more seminars to run. Later this year, we'll be going to Chin and Kachin states. Other organisations are contacting us, asking us whether we will come out into their areas as well. There's a lot of work to do. We want to thank you for supporting the Buzzoff seminars and the Buzzoff malaria campaign. So far, we've been working in Myanmar, although we have been doing some work in Papua New Guinea through YWAM medical ships, and we have been providing some funds to clinics in Western Papua in Indonesia, where they have almost no support for their malaria work during the wet season. Buzzoff has the potential to spread to many nations, but in order to do that, we need your help. Get behind Buzzoff. Go to the website. Have a look around. If you're involved in Burma, go to the Burmese website. We need your encouragement and we need your support. Thank you.